Hello, and welcome to the technique and supply review for starting a peripheral IV. We're going to go over a few things, such as the tourniquet placement. Tourniquet placement should be about 6 inches from the site that you're taking a look at to insert the catheter. So you don't want it up near the elbow when you're looking low to the lower part of the forearm. You don't want it too tight. You want it only tight enough to block off the circulation to the veins along the surface. You want to avoid placing an IV in the hands whenever you're doing home care. Patients are extremely mobile and mechanical phlebitis is a problem. So you usually want to place the peripheral IV somewhere in the forearm area. You want to avoid the antecubital fossa or the AC area because it's over a bony prominence, and that's not something that you should be doing. What that does is, if you were to place it there and leave it, is if it infiltrates, the patient is not as likely to notice that there's swelling or anything in there. The joint will just become painful. There's like a pocket area in there that the fluid can build up in before it's actually seen. Don't tear tape and put it on something dirty that's near where you're doing the site prep, and then use that tape and put it on the peripheral catheter hub or on the skin underneath the tegaderm. You don't want anything dirty put near the site. So I'll show you a technique of where you can put tape if tape is what you would like to use. And if a patient's veins, maybe they're dehydrated, they're not really popping out at you, you're having trouble palpating a clean track for the length of the catheter that you're going to be placing, then you can put some warm compresses in the area and dilate the veins well. So let's review supplies and show you the technique of inserting a peripheral IV. The supplies that we give you is an IV start kit, of course, an extension set with the end cap on, peripheral IV, saline, 10 unit per ml heparin, and some alcohol pads. Like all supplies, you want to inspect them and make sure that they're not damaged in any way or wet. Expiration dates are good. And then we can go ahead and open up our supplies. We, of course, have explained to the patient what's going on. We've washed our hands. We've prepared our work area from an infection prevention standpoint. We have done all of that. When I open up supplies, I like to hold on to the supply like this so that it doesn't fly out, land on the floor. The difference with peripheral IV placing from when we showed the PICC line or the portacath is it's a clean procedure. Meaning I put on my gloves, and those gloves are going to protect me from any body fluids or blood or anything. It's not something that I need to stay sterile. I still have the habit of putting on my gloves the same though, with the little cuff. So my gloves are on. I'm going to prime my extension set. Again, it was sterile inside the package, so if I didn't touch this area, I would not need to use alcohol, but it's okay if you do. You want to do a nice scrubbing of that. Take your saline, push straight in, turn gently, and then let 1 or 2 drops come out the end. You do not need to remove this cap. This is the protective cap. You do not need to remove that in order to prime the tubing. And then I just lay it here, waiting for me to use it. Your peripheral IV catheter, I open it up. This is a 1-inch catheter. So I want to make sure when I'm looking for a vein that I'm looking for one that has gives me the ability to thread and not run into any valves or any immediate rights or lefts that the vein might take. Inside our kit we have a tourniquet, an infection prevention note on the tourniquets is you do not want to carry these around in your bag, at the bottom of your bag, from patient to patient without making sure that you follow the INS standards for cleaning and disinfecting anything you use from patient to patient. And we give you one of these in the start kits, so you should be able to use ours. Here's the tape that I was speaking of. And you can use the tape and put it places like this, on the back of the piece that you tear off here. So there's places you can put the tape besides having to put it on the table. Your alcohol pads inside to be able to help you clean the site and to visualize the vein more. When the patient's tourniquet is on and you're pushing that toward the patient's body, it helps make that very nice and plump, where you can palpate along the vein that you're going to be putting the catheter into. Using the chlorhexidine swab that we give you, to activate this, you simply squeeze, and that breaks the seal and allows it to get into that cotton area, and you clean the area good, squeezing gently. Now we're ready to actually insert our catheter. When you go to remove this, you want to pull it straight out so that the blue piece stays connected. If you ever accidentally pull this away, you don't want to reposition it because you might be tearing some of the catheter there. This is a passive safety needle, so when you remove the needle, there's a piece in there that activates, that protects the end of the needle so you can't get stuck after you remove it. And the bevel should always be up when you go to insert. And there's a little finger piece here that this product has for you to be able to use to thread with one finger. I personally still use the two-handed technique just because that's what I grew up doing, so to speak. So we're going to hold the vein taut. We're going to go to insert. Right after we feel that initial pop, we're going to stop and kind of take a breath, lower it, and then thread the catheter in as we remove the needle and put pressure here to keep the blood flow from coming out the end. This is that passive that I told you about that kicked in. And then I can connect, let's get this to the side. I can, as I'm holding pressure here, I can connect the extension set, flush my catheter, make sure I get a flashback of blood, that I'm in the vein good, and that it flushes without any trouble. And some people, again, would take dirty tape off of a table and put underneath here, and you don't want to do that. And you apply your dressing. Making sure you put your initials and the date on the outside, and you document well exactly what vein that you went into, how many attempts, what catheter gauge and size that you used. And that is our peripheral. You would flush with 10 unit per ml heparin depending on the order, so you always want to check your orders. Some patients will require it and some situations will not. So thank you for joining us for the peripheral IV skill.